what actually happens if you don't pay your health insurance? Hello you guys, and welcome back to the Life in Germany channel. My name is Jenna. If you've not been here before, here's a little bit about me. I am a Canadian. I am living in Düsseldorf, Germany, and I have been here since 2014. Over here on this channel, you can find all of the culture shocks and stories that I've had along the way, but also a lot of great tips that are gonna also help you get started as a foreigner living here or moving on over to Germany. Now today we are going to talk about a very popular question. What actually happens if you don't pay your health insurance? There are so many ways that people think that they're so clever that they can beat the system, and while yes, you're probably right, there are no Ordnungspolizei that are actually tracking you down to say, where's your health insurance? So while you could get away with it, the thing is, as soon as you realize, oh crap, in order to work here in Germany, in order to study here in Germany, in order to do pretty much anything here in Germany, staying long term, you need to have the right health insurance. The one thing that you have to get into your mind is that health insurance in Germany is mandatory. If you're watching this video and you're like, well, why would somebody not have health insurance? Some people just don't know. Other people who live in Europe sometimes think that the European health insurance card is valid. Well, it is valid for 3 months. As soon as you decide that Germany is going to be your place of residence, this is where you will reside, you need to be in the German health insurance system. You've probably already heard that in Germany, you have 2 different opportunities when it comes to registering or joining the healthcare system here. You have private health insurance and you have public health insurance. A good rule of thumb is definitely make sure that you take care of this before you actually come to Germany. All of the visas that you're going to apply for in Germany do require you to have some sort of health insurance. Now it gets a little bit confusing here because you can also register for expat health insurance. This is something that you can consider when you're first coming to Germany, when you don't have a job yet, perhaps you're just coming for a language school, you're not planning on residing here in Germany for the long run. That is something you can look into. I highly recommend you talking to the professionals about that and getting all of the answers you need up front. But if you don't want to go that route, you are going to have health insurance of some sort. We will jump into the difference between public health insurance and private health insurance in just a sec, but I want to dive deeper into the question, what happens if you don't have health insurance? Well, when the time comes that you are ready to register yourself in a health insurance company, they're gonna sit down and ask you the question, where were you insured before and how long have you been living in Germany? In order to prove how long you've been in Germany, within 14 days of moving here, you need to register yourself in the city. That document shows them exactly when you moved here. You have a 30-day grace period. That means that you have 30 days where health insurance providers will say, okay, don't worry, you were just getting started. It took up to 30 days to figure out exactly which health insurance company you would like to go with. That's okay. As soon as you pass this 30 days, that grace period is officially over. What does that mean? Any additional month that you are not paying health insurance, you are going to be back charged for. Let's say you want to go with a public health insurance provider and you sit down with insurance company A. They are going to ask you, when did you move here? You might need to provide those documents, and have you been insured before? If you have not been part of the official public or private health insurance system here in Germany, you can be back charged the highest amount per month for public health insurance, which is just over 970 euros a month. So I hate to break it to you, you might be thinking, okay, 1 month goes by, 2 months goes by, 3 months goes by. Great, at least I've saved 3 months worth of health insurance because I didn't even go to the doctor, so nobody found out. You're gonna be back charged. If you're listening to me right now and you're like, oh my God, have I done it right? What do I need to do? I'm so confused. Don't worry. Not everybody is gonna have to dive deep into this topic when they first get here. If you have already found a job, chances are you might have already talked to your employer about your options for health insurance here in Germany. Legally, of course, you have the right to choose which health insurance provider you would like to go with. When it comes to the public healthcare system, most of the costs are quite on par. Some have extra bonus programs, but but generally speaking, they're all relatively similar. But you can also choose, if you want, as an employee, to go the private healthcare direction. Only if, as of 2023, you are making more than 66,000 euros a year. That's before taxes. So in Germany, they say brutto. In English, we would say your gross income. If you're planning on coming here for education, well, you might have to do it yourself, but you might not. I would recommend contacting the university, college, educational facility and asking them if they provide that support or if this is something that you're going to have to do on your own. But if you are a freelancer or self-employed like myself, this is something you are going to have to do entirely on your own. So listen carefully. Regardless of which boat you're in or why you're here in Germany, you're gonna have to pick an insurance. So let's go through the public system and the private system now, and you can figure out what works best for you. We have got our public health insurance. This is your statutory health insurance, and in German it is called the gesetzliche Krankenversicherung. As it stands right now, about 85% of Germans are actually on this public healthcare system. Whether that's because of personal preference or they make less than 66,000 euros, this is a very popular option for many Germans and internationals. One of the coolest things about the public healthcare system here in Germany is that it is based on solidarity. In Germany, 100% of people are actually covered by health insurance costs. In countries like, for example, America, this isn't always the case. In Germany, that is not a problem. It is mandatory to pay your health insurance fees, but the good thing is this is all dependent on how much you make. So it is a percentage of your annual income. If you are employed, the employer actually pays 50% of that percentage, which at the moment sits at 14.7%. The public health insurance is basically your basic care here in Germany. Everybody is treated the same. We are all equals and we all get very, very excellent healthcare. The maximum monthly contribution rate at the moment in 2023 sits around 977 euros a month without children. Although public health insurance doesn't have as many benefits as the private health insurance, one of the biggest benefits is that all of your medical bills will be paid through the insurance provider, which means you give them your card. There is a little chip on that card. You can stick it in a machine, or the doctor, receptionist will put it in a machine, gather your information, make the payment through your insurance company. Now, let's dive into private insurance. As you already know, if you are employed and you make more than 66,000 euros a year, you can actually voluntarily go into the private health insurance scheme. Additionally, any civil servants, teachers, police officers, anybody working for the government, you can also join the private health insurance scheme if you are self-employed, regardless of how much you make annually. So why would you go private? Well, when you go private, we're not looking at this solidarity concept anymore. In private, you actually do get quite a number of benefits. Why? Well, that's actually probably because doctors usually prefer taking private patients. You typically get an appointment much quicker for a specialist or any type of doctor. There are also clinics that are specialized in accepting only private patients. This is because the doctors typically make around 2 to 3 times the amount with a private patient as they would a public. So typically you're looking at better coverage, shorter wait times in the doctor's office, shorter wait times for specialist appointments, and individualized medical care. And although I have been here since 2014 and I somehow spend way too much of my time diving deep into these topics to help you guys out, I did have a little bit of help making this video, and that is all thanks to Expat. If you haven't heard of them, they are an independent insurance broker here in Germany, helping expats like you and like myself get started here in Germany. They help you figure your way out through over 1,000 different tariffs and over 100 different providers. That's a lot to figure out. The whole team at Expat is also made up of expats just like us, so they get it. They've been through it. They've been in our shoes. Although it is absolutely free and unconditional, you can just send them a message, ask them whatever questions you might have. They still take care of you before and after, so they can help register you for health insurance before you even come to Germany, absolutely free. At Expat, they also speak English, German, Italian, Spanish, and Hindu. I will include their link down below. You can go check them out. If you have any further questions about insurances in Germany, they will be more than happy to help. Again, it costs you absolutely nothing, so it doesn't hurt, does it? What do you think about the German healthcare system? I come from Canada, and I have to say, I really love the German healthcare system, and I hope you do too. Vielen, vielen lieben Dank und wie immer, bis später.